We are back on Taking Care of Business on Current Radio, News Talk, 1180, 1230 KGEO, 1410 KERI, now in Albuquerque, New Mexico on 1000 KKIM, and 3 times a week on the Internet nationwide through knookmedia.com. Plus, you can catch any of our shows for the last 4 years on Clay and Marty Show on the Internet. So, Clay, what do you think of David Barton?
David Barton is an educated man.
Yes.
He knows his Bible.
Yes, I wish we had more time with him. You know, he's been called America's historian, and that's very appropriate.
Well, he sure gave us a lesson this morning.
Yes, he did.
And he'll be here this coming week.
Actually, yes, he will. Tuesday, September 16th at the In God We Trust rally, 7 to 9 o'clock at the Marriott Hotel in Bakersfield. Brad Dacus will be the second guest. And the phone number to call if you're interested in tickets is 1-800-381-3020. Unfortunately, you and I won't be there.
Well, I'm going to be there.
Oh, you are going to be there?
Okay. But, you know, I'm pretty excited about our next guest because this is up my alley, employee benefits and how we can help large employers defeat Obamacare ACA regulations.
So who is our next guest?
Diane from Benestream back in New York.
Aha. Diane, welcome to Taking Care of Business.
Thank you very much. I'm glad to be here.
Diane, you have a unique program that helps large employers eliminate the need to cover all of their employees under the Affordable Care Act, which can save them thousands, hundreds of thousands, and with one of my groups, even a couple of $1 million. Can you talk about that?
Sure. This is a wonderful new opportunity for employers to address the health needs of their employees in a much more affordable way. Our company was founded to find a technology solution to enable employees to register and enroll in health care at the workplace, because what they found is employees who qualify for Medicaid have difficulty often getting to those nonprofit community centers in their neighborhoods. It might be an hour and a half bus ride away, and they only have one day off a week, and so it's very difficult for them to get there. By offering the enrollment services in the workplace, what ends up happening is many people are eligible for Medicaid under the new rules about Medicaid expansion in 28 states and the District of Columbia. And so when we get them on Medicaid, what ends up happening when their employer is mandated to offer them insurance at their open enrollment date is they say, no, thank you. I don't want to have to pay the employee's share of those premiums. I'd rather just keep the Medicaid, which is at no cost to them, and then gives their entire family coverage, including catastrophic care, at the taxpayer's expense instead of the employer's expense. So it's a great way for the employer to limit their new obligation to cover these employees because it's a valid waiver from the Affordable Care Act. You can still have to offer insurance, but the high likelihood is that those people who are already on Medicaid will reject that offer.
So basically, an employer has to offer benefits to their employee, and if they don't offer benefits to their employee, what's the consequences?
So the Affordable Care Act actually has a mandate that employers of 100 people or more have to offer insurance to everybody who works 30 hours or more, which is determined to be full-time from the Affordable Care Act point of view, or they get fined. If they don't make that offer of a plan, they can get fined $2,000 per employee. And while our company is offering this ability to enroll in Medicaid while at work for a cost of $240 per employee per year, it's a really great solution.
And that's $240 versus paying an excise tax of between $2,000 and $3,000, which is non-tax deductible, or paying an insurance premium for a low benefit plan of between $2,000, $3,000, or $4,000. They only have to pay $240 a year, and the employee, I understand, gets a full medical plan, a dental plan, and a vision plan. Plus, you'll also help that employee get into food stamps. Is that correct?
That's right. In addition to Medicaid, if we find someone's Medicaid eligible, in most states they are qualified to get food stamps, and we assist them in applying for food stamps at no extra cost to the employer. Also, we assist them in applying for one member of the family to get a Lifeline phone, which is not a smartphone. It's just a simple phone for emergency purposes, and they can get that for free for one member of their family. So it's really a great opportunity, and what it does effectively is increase the disposable income of these working families So even if they think they're already on Medicaid, which, by the way, many people in this demographic have been used to going into the emergency room and getting care, indigent care, and now they really need to have a valid Medicaid card. The Medicaid cards can lapse if someone hasn't gone into the emergency room in 15 months. So it is an annual recertification program, individual by individual, and our company provides a methodical, systematic approach of keeping track of each individual, even those who are already on the Medicaid system in their state. And we're involved in 29 states who have recently, by accepting the Medicaid expansion, increased the availability of Medicaid to these families that are making between the federal poverty line and up to, in the case of a family of four, $32,900 is the annual salary equivalent that would qualify for a family of four.
Wow. Our guest by phone is Diane Keefe from Benestream, giving us some options here to Medicare and Medi-Cal.
For large employers.
Yeah, for large employers. And the large employer market is changing January 1st because that's when Obamacare takes effect, right?
Employers have to offer benefits.
Right, as of January 1st. So we're coming up to a big change here. Now, what defines large employers?
Large employers are a group of 51 or more full-time employees or full-time equivalent employees.
Now, isn't it 100 though for the law change January 1st?
Not yet. No.
Are you sure?
Yes.
Okay.
So actually, for employers of 50 to 99, their need to comply is delayed until 2016. It's employers of 100 or more that are required as of January 2015. And actually, employers of 200 or more, there is a clause in the Act that requires auto-enrollment, meaning that automatically people who are determined to be full-time employees and make are in the category that's regulated by the Affordable Care Act. But the date at which auto-enrollment has to take effect during 2015 has not been defined in the regulation. So some large employers are being forward-looking and doing that auto-enrollment. But the great thing about doing our service is that even if you've already enrolled your employees in a plan, Medicaid is a valid qualifying event, and you can take them off the plan. So they might have been on the plan for 3 weeks or 3 months sometime during the 2015 calendar year, and we can still take them off at that point. And it's just a superior alternative. For instance, the Medi-Cal and Medicaid program offers free pharmacy, dental, and vision for everybody in the family, whereas very few of the plans that are offered in the private sector right now, either bronze plans or minimum essential coverage plans, which are qualifying plans from the Affordable Care Act point of view, but again, it's insufficient in terms of delivering comprehensive preventative coverage, in terms of health care. Dental coverage is very, very important for children and adults. And the other thing that's really important to think about is that for a family who's making $25,000 a year and has kids, it's really tough to meet a deductible of $3,000, $4,000, $5,000, before you get $1 of reimbursement from an insurance company, whereas Medicaid has no deductible. So that's huge. And from an employer's point of view, those families who are making less than $32,900 who choose your offering, when you make that offering, it is very likely that they've got somebody ill in that family where they know they're going to blow through that deductible and they're actually going to use it all and have what we would call a really negative claims experience, which could sour your premiums on a going forward basis for your entire employer-sponsored plan. So the great thing about Medicaid is it takes all comers who qualify from an income point of view, and there are 60 questions on the Medicaid application, so I don't want to oversimplify it, but the reality is that what you are doing by identifying those who qualify for benefits and allowing them to make it easier to get on those benefits is it's removing potentially a lot of increases in premiums going forward for your whole ESI program. Your employer-sponsored program. A
quick question, Diane. Under the dental plan offered through Medi-Cal or Medicaid, does that meet the pediatric dental requirements?
I'm not familiar with the details of the program. I just know that it doesn't cost anything.
I see.
I know in my own plan, I was kind of flummoxed that I had to pay for vision, because to me, vision just should be straightforward, part of it, but apparently it's not included.
Diane,
I'm not lucky enough to qualify for Medicaid.
Yeah. Diane, this is Marty, and I'm relishing the moment I had there a second ago because, Clay's the man I look up to when it comes to this, and I actually knew something he didn't know about the 100 people being the threshold January 1st, so I relish that little moment there. When we
Once a year.
When we come back from the break, let's pick up here, okay? We'll be back in a moment on Taking Care of Business on Koerner Radio News Talk 1180.